All right, we will go ahead and get started. I think we have a critical mass now. Thank you everyone for joining today, and welcome to the UAV for Payload Delivery Working Group webinar on distributing COVID-19 vaccines and the role of drones in Ghana's health supply chain. Very excited to have you all here today and to have our guests with us. I'm just going to start with a few housekeeping items. So my name is Gabo Ailstock. I'm the coordinator of the UAV for Payload Delivery Working Group, or UPDOG. I'm going to be your host today. So our webinar is going to be 1 hour in length. We're going to have about 35 minutes of a presentation, and then we'll leave about 20 minutes at the end for question and answer. The webinar will be recorded, and it will be available on updog.org and emailed to participants next week. So we have two ways that you can contribute to the discussion today. The first way is that you can contribute non-verbally through the question and answer feature at the bottom of your screen. You can go ahead and add in your questions as we go throughout the webinar, and I will at the end repeat select questions to the group. If we don't get to all the questions today, we'll make sure that we follow up via email after the webinar. And the second way you can contribute to the discussion is through the raise hand feature. During the Q&A time, if you want to contribute verbally, go ahead and hit that raise hand feature at the bottom of your screen. I will invite you to speak. You'll get a little pop-up that says the host would like to unmute you, and you can choose unmute now, come off mute, and start speaking. So I will now introduce our guest presenters today, and then I will turn it over to them. So we're really excited to have two wonderful presenters today from Zipline and from Ghana Health Services. So Kwasi Anchi is the Health System Integration Lead at Zipline, where he manages the integration of Zipline within the health system in Ghana, as well as the relationships with other public health stakeholders in the country. And we also have today Dr. Kwame Achiano, who is the Managing Director of Ghana Health Services Expanded Program on Immunization. He has over 20 years of experience with Ghana Health Service, where he provides technical support for immunization activities, including coordinating new vaccine introductions. So very, very happy to have you both here today so that we and our audience can learn from your very important work that you've been doing in Ghana with the COVID-19 vaccine distribution. And from here, I will actually hand it over to both of you to go ahead and get started.
Yeah, Gabriel, so Dr. Chano is now on call. He's asked that he presents his slides from his end. Then after that, you upload mine so that you share my screen so that I start my presentation.
Okay,
so Doc,
great. Go right ahead.
Good afternoon from Ghana. Thank you very much.
Good afternoon. You can go ahead and share your slides then.
Thank you. Just a minute, please. Yes, I guess you see my slides. My screen. Yeah, thank you very much.
Thank you.
Right, good. So I would take the first part, and Kwasi will then continue with the Zipline portion. So I'll take the immunization portion. Yes, we have a mandate of contributing to poverty reduction and, of course, the magnitude of vaccine preventable diseases through primary health care. Our main goal is to protect children and pregnant women living in Ghana. We, as a program, was launched in 1978 4 years after the launch of the EPI by WHO. So we scaled up between 1985 and 1991. So by 1991, we're full blown. Currently, we are vaccinating against 13 vaccine preventable diseases within the routine. Our key strategies have been static delivery that is based in the health facilities. We also do outreaches into the communities. We do mobile clinics as and when they are important, and then we do mop-ups and campaigns, vaccination campaigns as well. So these are the targeted diseases, as I mentioned, 13 of them, from tuberculosis through poliomyelitis, diphtheria, pertussis, or whooping cough, tetanus, Haemophilus influenza type B, hepatitis B, pneumococcal diseases, rotavirus, diarrhea, measles, rubella, yellow fever, Neisseria meningitidis diseases, and then other VPDs depending on the burden and as they become important. So this is just the chronology of our vaccine introductions. I mentioned 1978. So through 1992, 2002, 2012, 2013, 2016, we've been adding on vaccines until just last year when we started with the malaria vaccine pilot program together with Malawi and Kenya. Yes, so these are the operational components of the immunization, just as it is everywhere. We have vaccines and the quality of it. We look at logistics, advocacy and communication, and surveillance. And within that, the center of it is the service delivery itself. Yes, so these are, I've mentioned the types of service we procure, or we type of service we deliver. And just to summarize that, we also do national immunization days, especially against polio, and then other supplementary immunization activities. So what have been the success, the key success stories? We have a very robust routine immunization program, which is part of the service, the General Ghana Health Service. We've conducted several vaccination campaigns against many diseases for both children and adults for over 4 decades, but mainly polio, measles, yellow fever, meningitis, and tetanus. Of course, we've contributed in reducing under 5 mortality in the country. We were declared having eliminated neonatal tetanus in 2011. We are at the brink of eliminating polio or eradicating polio. We've been part of that success story as well. I think this will be the last slides for me, but I know Kwesi would also speak on this one as well. So essentially, I'll take the yellow part because I am responsible for immunization. So we receive vaccines at the national code room. We do a quarterly push to the regional level. We have regional warehouses or regional code rooms dotted across 10 out of 16 regions, 6 of them being very new, and we are still planning to get them code rooms. Then from there, the districts do a pool system. So we have a 3-tier system: national, regional, district. And from within the district, the facilities also pool. And I should say that we have quite difficult terrains, and that is where Zipline comes in handy. Yes, so on COVID vaccines, we have had our deployment plan prepared already. Our initial target is 20 million. In fact, it's actually 17.5 approximated to 20 million, starting with the most at-risk groups, basically health workers, people with underlying conditions, persons above 60 years, and then frontline security persons. But ultimately, the vision of the country is to consider the entire population using the same strategies that we have been using for campaigns, and of course, routine. So static outreach, mobile, camp out, and a combination of them. And as I did indicate, even though our initial target is 17.5 million approximated to 20 million, vaccination will be expanded to children and pregnant women as and when we get enough safety data on these subset of the population. So just a bit of how far we've come in terms of deployment of the vaccines that we have received. So far, we've received about 1.3 million doses of AstraZeneca Covishield from Serum Institute of India, directly and indirectly from COVAX. So we did a phase 8. It's being based on vaccine receipt. So we've done 3 phases: phase A, 1A, 1B, 1C. So 1A looked at both population segmentation and geographic segmentation. So you see on the right side, the dark areas are hotspots. So we picked 43 hotspots where we had a lot of cases and tried to mop in terms of the vaccine, given that vaccine supply was inadequate. Then we did a phase 1B that we covered the entirety of the country, frontline health workers. Then we had a phase 1C where we looked at a mixed target, including those frontline people with underlying conditions, as well as some as part of the population, general population. So to date, we've delivered or deployed 1,232,876 doses. And the next slide is showing us which areas or which people have received this in terms of the target segmentation within the phases that I've mentioned. So we've delivered approximately 500,000 doses to the most at-risk groups, both in terms of hotspots and then also the population segmentation that I earlier on alluded to. Then for the health workers, we've covered approximately 316,000 or say 317,000, including students who are clinical year students. And then 380,829 have had a second dose of AstraZeneca. As you know, AstraZeneca comes in 2 doses, just as many vaccines like Pfizer, so except Johnson & Johnson. So this slide is giving us a snapshot of the summary of what we have done. So for the total doses, as I mentioned, 1.2 million plus, 852 have at least received, 852,047 have at least received 1 dose, and then 380,829, as I said, have received 2 doses. So we have approximately 470,000 who are waiting their second dose of AstraZeneca vaccines. Yeah, so this is by way of sex, almost equal male and female distribution. So a few gaps in our cold chain, the supply chain system. The cost in assessing very rural areas, as I did indicate, we have quite rural areas and quite some areas that are very rural. And we have also had some gaps in cold chain and logistics. We've done a gap analysis, and overall 15 districts, according to the analysis, would require cold chain equipment, new cold chain equipment for that matter. 7 regions would need working cold rooms. I did mention that we have 6 new regions out of the 16. So the 6 new regions plus 1 additional region that has had challenges with cold chain in terms of breakdown. So these requirements are based on the characteristics of the chosen COVID-19 vaccines. But we have prepared to receive vaccines that are +2 to +8. But ultimately, we are also looking at revamping our ultra-negative cold chain system so that we can receive Pfizer as well. So yes, these are some of the terrains that we have, very difficult ones, and Zipline has come in handy in supplying vaccines to such areas, particularly those that are over the banks of the rivers and those in island areas. So Kwesi will take over from here. Thank you very much for listening to me.
Sorry to interrupt, but I don't think your slides have advanced since the performance by phase slide.
Okay, so let me try and back and see if I can reach it. Sorry about that.
That's
Did
okay.
you see my screen now?
Yes. Now okay. We see the one with the
Sorry.
photos.
So I think I stopped. Probably you got lost from here.
Yeah.
Yes.
Okay. So this is what I was talking about, the snapshot of the performance, at least 1 dose, and those that have received at least 2 doses. And then also the equal male and female distribution in terms of vaccine delivery. Then I spoke about the vaccine gap, the gaps in supply chain, in terms of the number of districts requiring new cold chain equipment and also the regions. Then I spoke about the terrain, the difficult terrain, where we have people living at the bank of rivers or over the bank and on islands, and sometimes our motorbikes break down. And I made mention of the fact that Zipline has come in handy to support in terms of vaccine delivery to such areas. And this is where I said proceed and take over. I hope my slides have advanced.
Yes, they have now. Thank you.
Thank you very much. Kwesi, over to you.
Okay, sure. So I'll go ahead to share my screen. Give me a few seconds.
I'll stop sharing mine. Then you can do this.
So I hope everyone can see my screen. Gabriela, can you see my screen?
Yes, we can.
So I'll start by playing this video, just a few minutes, and then after that, I'll start my presentation.
Finally, a lone health worker at the only clinic in their Afram Plains area is begging for support just to get a solar-powered refrigerator for the facility.
Can you hear the sound on the video?
The
Yes, we can.
Compound currently has no
sure.
electricity and no refrigerator to preserve medicines, a situation that puts the lives of the hundreds of people who seek medical care there at risk. Here's a report by our own Justice Baidu.
Moses Ganke is one of the country's frontline health workers, going at it alone in one of the places where many of his mates would rarely go.
Talking about the challenges, in fact, if I want to start, I can say I may not even finish.
This is the island community of Hlen Haji. It has no electricity, no potable water, and no mobile telephony network. The only clinic here was built by the villagers themselves. Moses recalls how the lack of refrigerator for medicines affects the work that he does.
Just last month, I did 5 deliveries. During delivery, you have some emergencies or complications, and those drugs that you can use to ameliorate those situations are supposed to also to be kept under coating or in the refrigerator as well. But where is the fridge? The deliveries, you have to do it because you don't have enemies. By the time you say you are referring them, they might either deliver on the bank or on the lake.
He has to travel on the sometimes turbulent Afram River using a boat, a journey that sometimes could take up to 2 hours to the nearest community that has electricity every day to store medicines like vaccines.
The facility we are not having engine boats, so I have to rely on people who are having. They don't even have commercial boats that apply to where I store the vaccines. So I have to be begging them, making arrangements. So by the time they are done, it's almost getting to see something. I am appealing to the authorities, the government, Ministry of Health, Ghana Health Service, and benevolent individual or Ghanaians. This one I'm not just appealing, I'm begging. In fact, I don't know if I should be on my knee, but maybe it will disturb your recordings. Otherwise, I will be on my knee. For them to come to our aid, to save these innocent children.
Moses' story is like that of many health workers in remote communities across the country. He is hoping that something changes about that soon. Justice Baidu, Joy News, Hlen Haji in the Afram Plains.
Oh, so we have to end the news tidbit now, but we do have more news.
Okay, so you can hear me still, Gabriela?
Yes.
Okay, so I just shared that video for us to get a true sense of what we mean when we say facilities in rural areas, and it also allows us to put into perspective the mission of the mission of our company Zipline. So our mission as a company is to provide every human being on the surface of the earth with instant access to vital medicine. So what that really means is that in our setting here in Ghana, it is to ensure that facilities never run out of stocks of vital medicines. And in situations where you have patients going to facilities with emergency needs, they have real-time area response systems to ensure that facilities receive the critical products needed to save the lives of patients. So I'm sure you know a bit about Zipline. Zipline, an American multinational area logistics company into the distribution of healthcare commodities. We are based in San Francisco. We are one of the few companies with our footprints emerging from, starting from Africa. We started from Rwanda in 2016, and in 2019, we set out to build one of the world's largest medical drone delivery systems in Ghana. So here in Ghana, we have 4 distribution centers in all, with 3 of them situated in the southern part of the country, and the last one in the northern belt of the country. And from these 4 distribution centers, you have facilities within an 80-kilometer radius enjoying drone deliveries of healthcare commodities, from medical products to vaccines to blood products. With our 4 distribution centers, we cover close to 60% of the population. And very recently, we went into an agreement with government to actually add on 4 more distribution centers. These distribution centers will cover some of the hardest to reach areas in the country, including riverine communities, islands, mountainous areas, and areas that are particularly very difficult to reach during the rainy season. So it is expected that after these 4 distribution centers have been set up, by the middle of next year, we would increase our population coverage from 60% to 80%. So most of you probably have seen videos about our drones, but what I wanted to highlight with this particular slide was our payload capacity. So we have a payload of 1.8 kilograms. And usually when you engage stakeholders and people about Zipline, the concern is around how small our payload capacity is. But if you put it in context, what our mission really is as a company, that is supporting ground deliveries from the regional medical stores and the regional cold rooms, you truly understand why we have a very small payload system. And if you care to know, if you translate this payload into the number of vials of medical products that we can deliver, it translates into 30 vials of vaccines, which could help sort out a small clinic in a rural area for a month. And it also translates into 50 vials of 50 injectables in a package, which could also sort out a facility or a clinic in a rural area for a month. So our system is set up in such a way that facilities are able to place orders to Zipline on WhatsApp. Facilities can also call Zipline or text Zipline with orders. And immediately we receive these orders, we package them in a matter of minutes, and we send them to our drone ports for the packages to be put into our drones. In a matter of an hour or so, at most an hour, you could have a drone delivering from our distribution center to a facility after it has been launched from the distribution center. The farthest facility away from our distribution center will be like 80 kilometers away in the air. And for facilities that far, we could actually deliver these products in a matter of 50 minutes. For facilities that are closer than this, we could actually have our drones delivering to these facilities in a matter of 15 minutes or 10 minutes. So when we were approached by the ministry to offer our support to the COVID-19 response strategy, what we had in mind to offer a bundled service where we don't just assist in the distribution of COVID-19 samples, but a service where we go on, or we move on to distribute sanitizers and PPEs after we've seen spikes of COVID cases in a specific area. And also we distribute COVID-19 vaccines to ensure that the rest of the population in that area is protected. So we started with the distribution of COVID-19 samples, transferring samples from facilities that have spikes in COVID-19 cases in their areas to testing centers in urban areas. And we followed up with the distribution of sanitizers and PPEs. And when we started having COVID vaccines in the country, we supported and partnered the Ghana Health Service to distribute COVID-19 vaccines in the country. On March 1st, we received our first batch of COVID-19 vaccines from the Ashanti Regional Cold Room. I must say that officially, we were the first company globally, aerial logistics company globally, on March 1st to start distributing COVID-19 vaccines using drones. And by this, Ghana was also the first country globally to distribute COVID-19 vaccines using drones. After receiving the 1,329 vials of vaccines, we distributed them in a matter of 5 days. And we also went on to distribute vaccine cards, bottles of sanitizers, and some consumer products that went along with these products to assist in vaccination at the facility level. To date, we've distributed 25,000 doses of COVID-19 vaccines, and we've had a lot more regions partnering with us in the distribution of these vaccines. Before we started distributing these vaccines, we put together certain strategies to ensure that we were well prepared for the distribution of COVID-19 vaccines. We first off ramped up our cold chain storage system to a point where we are now able to take stock of not just vaccines in the 2 to 8 vaccines in the 2 to 8 temperature range, but ultra low temperature vaccines as well. This was because we had a very good idea of the rapidly evolving dynamics on a global stage as far as supply of COVID-19 vaccines were concerned. And we were also very aware of the EPI's open-minded strategy of the EPI's open-minded position on the selection of vaccines for vaccinating our population. So I would probably say that it's a proud moment for the country that we are probably one of the very few countries in the sub-Saharan region and probably in Africa with a cold chain capacity to stock a wide range of vaccine candidates. And if we should receive any vaccines outside the normal 2 to 8 vaccines that we normally have, Ghana is in a very good position for warehousing these stocks and also distributing same to facilities or vaccination sites. We are also working on a protocol with Pfizer to a protocol that will guide receiving vaccines ultra low vaccines at our ports, send these vaccines to our distributing centers and distributing them to facilities via drones in specialized packages. We are working on a protocol with Pfizer on that, and we'll be publishing that paper by the end of July. Also, to ensure that we made very good use of every single vial of COVID vaccines, we also revalidated our packaging process and also conducted some product validation process to be sure that we could deliver a specific quantity of products to facilities without experiencing any loss. So it also helped in ensuring that the 25,000 doses of vaccines that we distributed from our distribution centers were all done without any product losses. So up until now, and we are still receiving vaccines, up until now, we haven't experienced any product loss as a result of delivery by drones and drop at these vaccination sites. Of course, after we've put the strategies together, we proceeded to train our fulfillment team on the new developments in our fulfillment packaging ways and the new strategies. We put a plan together to also make sure that we could contain instances where we have spikes in deliveries in a way that may affect our deliveries for other products like blood products and medical products for other facilities. So currently we have a protocol in place to ensure that if there should be any spikes as a result of more vaccines, COVID-19 vaccines coming in, we should still be able to contain that particular spike in the number of deliveries. Of course, we're able to test. What really helped us was that we were able to test all these learnings by having several campaigns with regional EPIs. So one that comes readily into mind was a campaign that we organized with the Western North region, where we had opportunity of distributing a little over 11,000 vials. It helped us to test our endurance system, and it also helped us to also, get some learnings around how we could truly prepare ourselves if larger stocks of COVID vaccines were received at our distribution centers. Given the highly volatile nature of issues around COVID-19 vaccine supply, we thought it's very wise to keep open communication channels with the national EPI and the other lower levels of the EPI. And on that note, I'll use this opportunity to actually appreciate the national program manager of the expanded program on immunization. He's been very transparent with us on timelines and any new developments that develop as far as supply of COVID-19 vaccines to the country is concerned. And we wish to thank him for that. So beyond that, we also built communication channels with the regional level to ensure that we understood clearly what their plan was for distribution of vaccines within the region. And it was also very helpful to also do the same with the districts, because really the districts are the key implementers of the vaccination exercise in Ghana. So based on this, we put together some form of guidance when it comes to our planning process towards receipt of COVID-19 vaccines. And I must say that this was largely as a result of some of the immunization campaigns that we participated in with the regional EPI. Largely what we do is that, first of all, we will receive an electronic copy of the distribution list from the regional EPI. That's when we receive vaccines or COVID-19 vaccines. The regional EPI coordinator will send us a distribution list of the specific facilities or districts we should distribute these vaccines to, the specific times and the quantities that we should distribute these vaccines to. Usually we would call facilities to be sure about these timeline schedules. And after we've finalized that, we go into planning resource-wise at both the fulfillment and the flight operations and what we will need to actually fulfill some of these orders. So from the fulfillment side, you can think about the number of packages that will be delivered, the number of deliveries, the impact on our the impact on our delivery system, and whether we'll need more hands to actually fulfill the entire number of orders in a day. On the flight side, you can think about the number of batteries, the number of drone bodies, the number of wings that we need to make sure that the campaign goes on without any blip. So all these things are planned well before we receiving these vaccines and after we've received information from the regional EPI. The normal structure of the distribution is such that we would send out buffer stock before the day of vaccination. And when facilities need more of these vaccines during the day of vaccination, they could call on us, then we would send them exactly what they need for that particular point in time. Of course, on a daily basis during the vaccination exercise, we send out reports to the regional EPI on the number of vaccines we've distributed and the specific places we've distributed to. So this was a very huge impact, especially to some of the rural areas we're serving in our, within our ranges of our distribution centers. We had a massive reduction in distribution costs from feedback from the regional EPI. And if you take a cursory look at the table on the right-hand side, you realize that for some of the districts, we actually contributed to the turnaround time for distributing vaccines being reduced by 50%. In fact, for a few of the districts that we serve, we actually reduced the turnaround time from 9 hours, 40 minutes to 33 minutes, which was like an almost 90% reduction in the turnaround time. So these districts will typically have to move to the regional cold rooms to pick up the stocks, bring them back to their district cold rooms before facilities come for the vaccines from their district cold rooms. But for instance, with Bodi district, instead of the facilities spending 4 hours just on this round trip, all they had to do was for us to take up the vaccines from the regional cold rooms and deliver them directly to the facilities within our distribution centers. We also facilitated borderless distribution of COVID-19 vaccines. And here I'd like to point out to one particular incident that happened at one of our distribution centers. So we had vaccines for a specific region, and the way that the API operates is that usually you have vaccines for a region to be used in the vaccination of the population in that region. We have vaccines for a region to distribute within a region. Then we had a call from one facility, which I've highlighted in red, Asankregua SHS chips, that they needed 50 doses of COVID-19 vaccines because they had run out of vaccine stocks. This particular facility was located in another region, but happened to be within our distribution range. So ordinarily, what they could have done was to move to the district level to get more vaccines. But it was late in the day, and also the district cold room didn't have stocks of COVID-19 vaccines at the time. So the option that they had was to postpone the vaccination for that day and probably drive all the way to the capital town of that region to get more COVID-19 vaccines. And that round trip could have lasted for 9 hours, 40 minutes. But because they found themselves within our range, all they had to do was to call us, and we distributed these vaccines in a matter of 33 minutes. If we hadn't done this, it would have meant 50 people missing out on their first doses. And you can imagine what would have happened. If you understand the way our rural setting is set up, there are a number of people who prioritize other things over administration of COVID-19 vaccines. There are times when they leave the vaccination sites, it is very difficult to get them back because they'll go on market days to sell, or they'll go to the sea to fish on other days, and it's difficult getting them back. So this was like a very, very good use case of how Zipline could make sure that each and every person was vaccinated at the end of the day, and to also facilitate borderless distribution of COVID-19 vaccines so that people are not distribution is not restricted by the boundaries, the regional boundaries, and all other boundaries that we have. We also helped in the prompt delivery of COVID-19 vaccines that were near expiry. So we happen to have received just a few of these vaccines, and it presented a very tricky problem to some of the very, very rural areas that we had in the country. Fortunately for us, we had distribution centers in most of these hard to reach areas, and all that we were supposed to do was to send these close to expiry vaccines to us for the vaccines to be immediately distributed. We're able to do that distribution in a matter of hours. So it helped to ensure that at least every vial of vaccine was put to good use in the country. For areas that experienced shortages during their vaccination side, like I already mentioned, we supported them with top-ups of these vaccines to ensure that everybody was vaccinated. And for regions that didn't have existing cold chain facility, we served as their powerhouse in the distribution of COVID-19 vaccines. And as Dr. Chiano mentioned, we had 6 new regions which were yet to receive their cold chain facility for the storage of vaccines. So we happened to serve most of the areas that these regions were supposed to serve, and served as a powerhouse for the distribution of COVID vaccines in these areas or in these regions with non-existent cold chain. We reduced the number of product losses because, I mean, distributing these products aerially will mean that you don't have to go through hours and hours of ground delivery to get to the products at the last point of vaccination. So if you look at, for instance, Asankregua, where you have to do a round trip of 9 hours, or you look at Swaman district in the table that I've just shown, you realize that it is very likely that you may have some of these vaccines getting broken, along the way. We also, by doing this, helped in minimizing wastage, and also did same for facilities without storage capacity. We would just send them a buffer stock, and when they've consumed that buffer stock, we send them top-ups so that we minimize wastage and ensure that every vial is put to good use. With more countries pledging and donating excess vaccines to COVAX, we are being optimistic and expecting that Ghana will receive more vaccines, and setting up new distribution centers in the coming months. It would mean that we'll be relied heavily on when it comes to the distribution of vaccines in general. Our new distribution centers, as I mentioned earlier, will be covering like some of the hardest to reach areas, riverine communities that have more than 50% being water bodies, mountainous areas that are difficult to reach, areas that are very difficult to reach in a rainy season. And we happen to find ourselves in a rainy season as we speak. So we are hoping that as these vaccines come in, we support particularly with the distribution of vaccines in rural areas, whilst EPI focuses on, the ground logistics of EPI is focused on the more accessible areas of the country. Thank you very much, and I'm happy to take any questions from the audience.
Thank you both so much for this really wonderful and interesting presentation. It's really great to kind of peel back some of the layers of the onion and see some of the behind the scenes work that makes these deliveries possible. So really wonderful to hear and learn from you all on that. We have a couple of questions that are already in the Q&A, which I will ask, but just a reminder, if you do have questions, feel free to add them to the Q&A, or you can also raise your hand and I can call on you and you can ask your question directly. So our first question is from Jarno, and asking about what data links are used and what are the most significant challenges with communication with the drones.
Gabriela, come again.
Sure. Question about which type of data link are used to connect the drones to the ground stations, and what are your most significant challenges with those data links?
Okay, so we currently we use we work with the telecom companies in Ghana in setting up telecommunication link between our drones and our distribution centers. So currently what happens is that each of our drones, even whilst in air, is able to establish contact with our distribution center. So whilst in air, we are able to point out a specific point where the drones is, and we make use of our telecommunication companies. Our drones run on SIM cards. So whilst in the air, we have some level of internet connectivity to communicate with the drones. Of course, sometimes you have downtimes as a result of downtimes at the end of the telecommunication companies, but to a large extent, we are able to maintain contact with our drones whilst they are in the air.
Great, thank you. And we have a question from Alex, which I might hand this one over to Dr. Acciano to answer. If healthcare facilities are not well connected by road, how are used expired vaccines or unused doses returned safely or disposed of?
Okay, thank you very much. Yes, we have a policy that vaccines that have expired are taken out of the cold room and put in a plastic bag and labeled, well labeled. Then the regions, as they go on supportive supervision, will collect them. We don't do this disposal of expired vaccines at the district level. So we do them at the regional level in the presence of partners, WHO, UNICEF, the Environmental Protection Agency, of course, the Ghana Health Service, for that matter. But for vaccines that have been used, our policy is we incinerate. So they are incinerated. And most facilities have an incinerator. If they don't have, there is an incinerator in the hospital. So the district director of health services coordinates that and make sure that somebody is assigned to take all the waste into the incinerator from time to time. So that's what is done.
Thank you so much. And now I will go to Frank, actually. So I will let you unmute Frank and go ahead and ask your question.
Yeah, hi, thank you. So my question is, we know, I mean, vaccine, these vaccines have, especially the COVID vaccine have a different temperature to be stored in. So did this Zipline have this cold chain available, or they had to put in new cold chain rooms specifically for this COVID vaccine?
Okay, so let me take the first part. Since it borders on cold chain, and then Kwesi will take over. Yes, so for you will recall that we have quite a number of vaccines in the system. Ghana has only approved 3 of those. The first to be approved was Sputnik, and followed by AstraZeneca, and now Johnson & Johnson. The last 2 require +2 to +8, which is the normal temperature we are used to in terms of vaccines. It's only Sputnik, which is -20, but we have -20 facilities at the national level. The Greater Accra, in fact, 2 regions, Greater Accra and Ashanti. And I know Zipline also has facilities for -20 and even ultra cold chain. But for now, we haven't had much experience with the ultra cold chain because we haven't approved of them yet. And so Zipline has never deployed or distributed any vaccine that requires ultra negative or negative temperature for that matter. Akwesi can add on to.
Yes, so we've been doing this for a while. I must say that even before the COVID vaccines came in, we were heavy into the distribution of vaccines in general. And by now, I think we should have crossed the delivery of 2 million doses of vaccines used during the national immunization program, that is. So we've always had that cold chain capacity to pick up your normal 2 to 8 vaccines, 2 to 8 temperature requiring vaccines. But because of these COVID vaccines, like I said in my presentation, we had to ramp up our storage to be sure that whenever the ministry or the Ghana Health Service or the EPI received any vaccines that fell out of 2 to 8, we would have the capacity to store it. So currently we have, in addition to our Helma fridges and freezers, we have also ULT Sterling freezers to assist us in the storage of Pfizer vaccines, for instance. So yes, we've had that cold chain capacity for a while. We just had to add on a few just to make sure that we could cater for the gaps in case we should receive some of these very low temperature requiring storage vaccines.
Thank you for the great questions and answers. And Olivier, I will turn it over to you to ask a question, and then we'll go back to the Q&A.
Hello, everyone. So wonderful work, great impact already. My question is about in regard to preparing for ultra cold gen dependent vaccines such as the Pfizer. Right now, it seems to me that for the DC, the distribution center that is far away, I'm guessing that you are delivering on a maybe weekly or bi-weekly basis some COVID vaccine to, for example, the North DC. How are you going to be managing the replenishment of the, for example, the Pfizer COVID that needs to be maintained in ultra cold from the national EPI to the DC? And how often, considering that it will be under very strict cold requirement?
Yeah, so that's a very, very good question. So the first step is that we now have ULT freezers at our distribution centers to warehouse these vaccines if we should receive them. We are working on a protocol together with Pfizer and the Ghana Health Service to validate a distribution system where we are able to receive COVID-19 vaccines from Pfizer at the ports, send them to the EPI or to our distribution centers. When they end up at our distribution centers, distribute them using drones with special packages so that facilities are able to receive these vaccines without any temperature storage issues, without we having to bother about any temperature storage issues. So it's currently a protocol that we are working with Pfizer on. And by the end of July, we should have published results on that. So we are close to building a distribution system that caters for Pfizer vaccines.
Thank you. And that aligns with another question. So I'll just confirm this. It sounds like the answer is a yes, though, but that protocol will be publicly available when you're finished, right?
Yes, it will be shared. It will be shared publicly.
That's great. Thank you.
Thank you.
And another question from Sid Trejo. It looks like the figures that were distributed via drone, via other means of transportation were fairly modest. So maybe Dr. Acciano, maybe you could speak a little bit to how you decided the strategies of which vaccines should be distributed by drone and which vaccines should be distributed by road to other facilities, and what were some of the strategies behind those decisions?
Okay, so we're not discriminating what kind of vaccines should be distributed. What we are doing is we are looking at which facilities would be helped by drone delivery. It doesn't matter the vaccine. And so we do not have a segregation of a type of vaccine being delivered by drone. As we speak now, all routine vaccines, as I took you through, and then also the COVID vaccine. So far, the only vaccine that we have had to distribute far and wide is AstraZeneca. And so there's no discrimination. Our discrimination is by facility and the access. And so that's it.
Great, thank you. And a question from Vignesh. Could you highlight some of the economic parameters that were considered in these missions? And I saw that you mentioned that the delivery cost was lower. Maybe you could expand a little bit more on that.
Was this question for me or for Kwesi?
Either. Maybe both would be great to contribute.
Yeah, so for us, we haven't done any formal study on the economies of the distribution. It's something that has been considered. What we know of is more of anecdotal in terms of the fact that we have very remote, difficult terrains, and sometimes during campaigns we have to go and sleep over in terms of even sending vaccines there. So what is happening now is that Zipline supports us with the drones so that you don't have health workers actually traveling with vaccines across very difficult terrains, especially on the islands, which can be very dangerous. And sometimes we don't even have the right jackets, safety jackets and all that. So it's difficult to quantify it in economic terms, but anecdotally, we think that that support is helping us to achieve our aim of getting to every child or woman for that matter. Over.
Yeah, Gabriela, Israel is on call. Israel is with our go-to-market, Africa go-to-market team. I know they've done some studies on that, not specifically with COVID-19 vaccines, but vaccines in general. So if Israel, if you're on call, if you could answer this particular question for us.
Yeah, as you just said, I think we haven't particularly looked into the COVID vaccine. I think countries are just doing whatever it takes kind of approach to be able to distribute. But as you know, in Africa, the vaccines are very slow to be coming in, and many countries are now looking to find the different ways that they could actually integrate them into the normal vaccination programs, and less in a harsh response to the pandemic. That will be a consideration that we look into. However, we've also been doing some internal analysis to look at what is Zipline's kind of impact and ability to impact cost aspects more broadly. And those are things that we are currently working on, and we should be able to share publications with the public that has to do with that. I'm happy to answer like specific questions via email or separately, since some of those things are things we could share, but we are still working on it too, especially with within Ghana, where we are primary supplier for COVID vaccines. I think we've seen significant gains economically, but also in terms of efficiency for the logistics and supply chain systems in relation to vaccine, and of course, fewer missed opportunities to vaccinate and increased access to vaccines, especially for hard to reach and hard to serve via ground facilities or expensive to serve via ground facilities. Thank you.
Yes, thank you for that. And sort of a tangentially related question from Tautis. Was this COVID-19 vaccine distribution already a part of the Zipline's contract with the Ghana Health Service, or was this an add-on that needed to happen quickly? And maybe if it was an add-on, maybe you could speak a little bit about how that worked within the public-private partnership.
So Kwesi, let me start and then you can
Okay, sure.
on.
Okay.
Yeah, for us, as far as the service and for that matter, the immunization program is concerned, we are open to all vaccines. So the arrangement with Zipline originally was generic. It was not for specific vaccines. And so once a vaccine comes on board, it doesn't matter which vaccine it is. If Zipline has a capacity to do so, they support us. Over.
Yeah, absolutely. And also we have, even though we are doing a number of flights, we have like some excess capacity that we could use in the distribution of COVID vaccines. So it was very easy for us to take up COVID-19 vaccines as part of our portfolio of products that we distribute. But like Dr. Achiano said, we deliver vaccines. And if there's a need for us to deliver any vaccines apart from the routine vaccines that we normally use in the country, we are available to do so.
Great, thank you. And Craig, I will turn it over to you to come off mute and ask your question. I think this may be our last question of today. Craig, you should have had a pop-up come up to ask you to unmute.
Hi, Gabriela. I did see the pop-up, but I actually hadn't asked the question, so my apologies for that.
Oh, no problem. No problem. Then Olivier, or I'll turn it over to you because I see that you have your hand up as well.
Yes, since this is probably the last question, I wanted to ask for both from the EPS standpoint as well as from Zipline standpoint, what is, if there's one challenge you would be able to explain and share with us, and so other can really learn from your experience if we could replicate that elsewhere. What is the one big challenge you have faced from the EPI standpoint versus from the Zipline standpoint in your accomplishment here. So it's a one question for each. What is the main challenge that people could benefit from learning from you?
All right, thank you very much. So again, I'll start from my point of view as the EPI manager. Our initial challenge was reconciliation of data. We have a very strict monitoring system, and we deliver to regions. Regions deliver, districts pool from regions, and then facilities pool from districts. So we have that kind of check and balances. But with the Zipline interface is delivery straight to a facility. And so what we have done together with Zipline and our various managers at the various levels is that we have an agreement that whatever data or whatever vaccine that Zipline delivers, if Zipline delivers to a facility in a particular region, it is charged against that region's code room. And therefore, they will take it on ledger post-delivery. And once Zipline has all the information in terms of how many vaccines are going where, we will reconcile our data. So I would say that in the initial stages, the data issue was our biggest challenge, but gradually we've tried to surmount that. Over.
Thank you. Maybe last minute for you, Kwasi.
Sure. So from our end, I agree with Dr. Chiano fully. It's a challenge that we've been having to deal with for a while now. And the way we are thinking through this challenge is to probably build a data platform, a data sharing platform where the EPI at the regional level and the national level can have real-time access to the products that we are delivering, where we are delivering the products to, and the quantities that we are delivering to these products. But then the other challenge as well is having to, and I like it that someone actually asked the question on this platform, having to actually cost and also think through how beneficial our service has been to the EPI and the Ghana Health Service in terms of cost savings. And we haven't had a lot of vaccines yet, and we are hoping that as more vaccines come in, we would have like a bigger sample size to conduct some of these studies and dig in deeper into specifically which areas we are seeing cost savings at the Ghana Health Service.
Thank you both. Just want to say we are at time today, but a huge thank you to Dr. Acciano and to Kwasi and all of the others from Zipline who helped and participated in the webinar today. We're extremely appreciative of your openness and your willingness to share your lessons and share your wonderful experience that you've had so that others in the field can also start replicating this wonderful work. So really huge thank you to all of our presenters and to everyone who joined today. The questions that we didn't get to answer, I will make sure that we get those answered after the call, and they will be in the slides that are emailed around to all of you. So thank you all for joining, and we hope to see you at the next webinar. Have a good evening or a good morning.
Thank you so much for having us. Thank you, Dr. Acciano. Thank you for joining. I know you're very busy. Bye. Okay.
Thank you, everyone. Bye-bye.